morning everybody and welcome to our team brief at LPT. It's good to be with you again. But it is with sadness that I've shared recent news with you all about the sudden death of one of our colleagues, Dr. Bomick, who I know many of you will have known and have been impacted upon. He has been devoted to LPT. He's internationally known, locally, nationally. I've had many colleagues already talk about the sudden loss and the great impact for them. So it's just a constant reminder of the importance of being compassionate for colleagues, because I know many colleagues across the Trust will be feeling a great loss and a great sadness. We will be sharing some more details. We're closely liaising with the family about his funeral arrangements, and I'm sure we're looking at how we can actually remember him in LPT too. So look out for that. But do be compassionate with each other. It's a very important time to demonstrate that. But moving on to other things then, I talk a lot about the CQC, and I know that we've talked about it in previous team briefs, but I'm really pleased to say that we've now got the Time to Shine workshops coming up. So if you haven't seen those on the email, please look out for them. Look for them on the internet too. It's a great opportunity to think about how you could and your teams shine when the CQC come, and to have thought about it before they come too. And the other thing that I want to mention, I know Cammy doesn't know that I'm going to say this yet, so I think I'm going to see her smiling, but I really want to encourage us to create a book of good. What I want us to do is to really start to get ready. I've seen lots of good and outstanding things happening across the Trust, and I want to pull it all together and produce a book of good that we give to the CQC when they come and before they come as well, to tell them what we're doing across LPT. So some more news coming out about that, but I want you all to get involved in how we can demonstrate across services what good we are doing. Now there's lots happening, again lots of conferences. I've just seen all the feedback about the AHP conference. It was fantastic. I was so sorry to miss it. Unfortunately I was on leave, but it was clearly very energising. So I want to say thank you to everybody who organised the event but also participated. We've got some great staff across the organisation, and that was never more evident than the AHP conference. We've also got the Quality Improvement Conference coming up on the 22nd of November as well at De Montfort. So again, another one to look out for. But what do we need to do internally? Lots of things. I know all of you are very, very busy, and I'm always poised to ask you to do more. But I do need people to fill in the staff survey. I've mentioned it every time. I've got to keep mentioning it because we're at 33%. Now we've got to get to 60, and trusts of our type average is about 36, so we're a little bit behind on the trust. So I really do need everybody to try to get time. I know it's difficult to fill in their staff survey, but it is important to us. We need to know what people think, and the CQC look at how many people are filling in those surveys too. Please be clear, it is anonymous. You know, even if there is a identified number, that's not for the trust at all. That's for the company that administers it, so it's not for the trust, so it is an anonymous survey, so please take the time to fill it in. The flu jabs, who's had the flu jab? Lots of people I know. Keep it going, keep everybody safe, your friends, family, patients, colleagues. Recent time I've been spending with our system partners. So yesterday evening I was spending time with our new accountable officer for the CCGs, Andy Williams, and people from UHL as well, looking at how we can work more closely together across the system, which is the expectation of the long-term plan. I feel really excited about that because I think LPT can be a really strong partner in delivering better population health for Leicestershire, Leicester and Rutland too. So more to come on that, but just wanted you to be aware there's lots of good discussions going on across as we start to actually prioritise both community and mental health too. I also want you to think about volunteers when you get a chance. We've got over 400 volunteers in this trust, which is impressive indeed. So when you get a chance, please thank the volunteers, because they are going absolutely above and beyond for the trust and making a real difference between good and outstanding care too. So if you come across a volunteer, please say thank you, because they are really making a difference. And we want more. So if you encourage people to come and volunteer for us as well, then please do so. And then finally, just wanted to mention great news that we've got the quality accreditation for our eating disorders services, again for our inpatient and day services.